Welcome everybody to today's session this afternoon is Medical Case Management and HIV and Incarceration. I'd like to introduce our speaker. Lisa Lugo-Manns is a Human Service Program Consultant in the Department of Correction, Office of Health Services. Her specialty is providing support services to the HIV/AIDS incarcerated population from all state prisons in Region 3, Martin to Arcadia, Florida. She also provides linkages to those residing in Broward and Miami-Dade counties. She has an office in Miami-Dade and Broward County where she monitors the client's compliance with care. She has 15 years of experience working in the HIV/AIDS field, linking individuals to care and support services. Lisa, thank you so much, and I'm going to pass the presentation to you.
Thank you so much, and welcome everybody for being here, and thank you for participating today. The disclosures, the activity planners and speakers do not have any financial relationships with commercial entities to disclose. The speaker will not discuss any off-label use of investigational products during this program. Just to go over a little bit of what we're going to be discussing for our session objective, what you are going to gain from attending this is you're going to be able to define and recognize the roles of the planners. You're going to identify the pre-release planners for the different regions of Florida. Define and recognize the roles of the Community Linkage Coordinator. Recognize the difference between the pre-release planning program and the Community Linkage Program, and these are two different programs that we have within the planning program itself. And recognize the importance of the medical case manager's role in transitioning incarcerated persons into the services and delivery system. Now, the pre-release planning program started in 1999. And it's contracted from the health department under Ryan White Part B funds. Under this pre-release planning program, we have 5 pre-release planners, and out of the 5, I am one that does half pre-release planning in the Region 3 state prisons, as well as half Community Linkage Coordinator for those returning back to Broward County and Miami-Dade. And the reason why there are 2 positions with this one job is because we have a very high rate of people returning back to these 2 counties specifically, and we had a lot of people falling out of care. So we try to help by having a Community Linkage Coordinator out there to assist them with services. The Department of Corrections has the 340B program for medication cost and specialized in medical care. All HIV/AIDS medications are released from the Department of Health. Region 1 has 6 prisons that has the 340B program. Region 2 has 7 prisons, and Region 3 has 8 prisons, which has the 340B program. Now, basically what this program does is we have a health department doctor, infectious disease doctor, that goes into these specific prisons and provides medical care to those that are positive. And it's really cost effective for the medications that need to be purchased in order to help them maintain their health care. Though it's not in every prison at this point, and we do not have those that are just specifically positive in these prisons because it is due to other dual diagnoses that they may have. Example, mental health with HIV, substance abuse. They all do receive the medications under the 340B program, and they do receive the medical care. We have a mission statement within the Office of Health Services, and it's a can-do mission statement. It's one that I really am fond of. Basically, C is caring for the inmates as patients first and not inmates. Their health care is a personal ethical imperative, and a healthy inmate is the goal of the Department of Corrections. Apply proactive methods in the Office of Health Services, and what our goal is to achieve community standards of care through constant education of health care providers. We would like to nurture relationships to provide improved correctional health care. We seek assistance from state resources and national CHC data to improve our ability to rehabilitate inmates and reduce recidivism. We develop strong relationships between the Office of Health Services and the Office of Institutions We work hand in hand to proactively prevent illness and longitudinally reduce chronic disease, and we organize data collection and management to improve efficiency. Incremental improvements and utilization management lead to successful health care. And basically our can-do mission is really to just to continue to work with the providers, work with the healthcare providers in the prisons effectively so that appropriate care can be delivered to every inmate that's there. Really to help them not look at them as inmates, but look at them as patients so that they can get the best care while they're there. We have 5 pre-release planners within the state of Florida, and you see here the pink section, that's Region 1, and Region 1 is Tallahassee, Jacksonville, and we have Robert Steve Griffin, who is the pre-release planner for that particular region. He is also the supervisor of this program. And Region 2, we have Ronald Jones, and Region 2 covers here Madison all the way on down to Flagler. He is the pre-release planner for this region, covers all of these prisons, and basically goes in and does everything else that we do, assesses the inmates, completes the needs assessment, does for continued care, as well as calling the Ryan White providers. At Region 3, we have Onwuchi Nakwacha, been with us, I believe, since 1999. And he is over all of Region 3, goes in, sees the inmates, and links them with services. Now, Region 3 has been extended. It used to be Region 3 and 4. The green part was Region 4 until the Department of Corrections has changed that whole region and has combined 3 and 4 together to be 3. So we have Region 3 that starts at Levy and goes all the way down to Monroe County. This is all now considered Region 3. Because it is so large, we have 3 pre-release planners. We have Onwuchi, who basically covers the central part of Region 3, and then we have myself that covers a little south, and that would be from my areas from Martin County on up to Arcadia, Florida. And then we have the lower part of Region 3, which is South Florida, which goes from Monroe County up to West Palm Beach, and that's Miss Ida Murillo. Ida and I share an office at Everglades CI, and Ronald has an office at the reception center. Onwuchi has an office at Sumter CI, and Steve Griffin has his office out in Tallahassee, central office. And we're at our offices probably once a week just to go through some of the documentation, but basically we're really on the roads, going to all the prisons, seeing the inmates before they're released, because we have to see them 3 months prior to their release. Now I'm going to talk a little bit about the pre-release planning program. You can have a very good idea of what that consists of and what our roles are and how we help our clients with care. We connect the HIV/AIDS infected inmates with Ryan White medical provider within the county that they are returning. That could be any county. They can be housed in Tallahassee and can be coming back to Miami-Dade to reside. And so what would happen is they would be referred to me so that they can get linked to Ryan White services in that particular county. They can be in Tallahassee serving their time there and come back to Lee County, in which what will happen, the pre-release planner will call the providers in that particular county and make the scheduled appointment for them to start their Ryan White eligibility upon returning back to that county. We release medical records to the inmate and Ryan White providers. There are copies of their updated CD4 counts, viral loads. I would say 1 year worth of copies are made for the providers. Their immunizations is copied. Any tuberculosis information that's in there is copied. Any mental health records, that's all copied. Their MARS forms, their medication list, anything they're allergic to. So we make copies of everything that's important for that provider to know about that particular client, so that when they go there for services, they have a history of what their medical care consisted of, and what medical issues they may have went through during their incarceration. We are responsible to provide 30 days of medications to state prisons. Every state prison is responsible to provide 30 medications upon their release. If we have an inmate that's released and did not receive the medications, then the pre-release planner needs to be notified, and we ensure that those medications are being released to that inmate via mail. And the address that they have in the system is the address where those medications would go. It does happen, unfortunately. It happens sometimes, but we do work very diligently in getting those medications to that particular client. And the client does receive the phone number for the pre-release planner that is seeing them in the prison, and all the planners have cell phones. So when that inmate is released and he did not get his meds or she did not get her meds, they would call that planner, and that planner would then follow up to make sure and ensure that those medications are being sent out. When we go in to assess the inmates, there is an assessment that's done. That first time we visit them, we basically visit them twice. The first initial intake is to, explain to them what our services are, what we're going to do to help them, how we're going to help them, find out what county they're going back to. We review their medical records with them. We talk about their medical care. We answer any questions that they may have regarding HIV and AIDS. So we provide a lot of education on that first initial intake. And then on the second visit, that's when we finalize everything. And we make the appointment of where they're going to go for medical care. We release that appointment to them with the time. We make copies of all of the medical records, and then we ensure them that when they are being released, they will receive a yellow envelope with all of their medical records, and the appointment date, the person they're going to see, and time is in that information for them. This program was actually created to really help reduce the rate of recidivism. One thing that was noticed is that when people were coming out of the state prisons before 1999, and even in the early 2000s, that for them to get linked to care was very challenging. It was challenging because they did not understand the system. It was challenging because they weren't familiar with what providers are out there. And so this program was really developed to help link with, to really stand in the gap with that, and to link them with care in whatever county they're going to. If you serve 10 years in prison, you may have went to one agency for care prior to that, and when you come out, that agency may not, or their services may have changed. And so we did have a lot of people actually falling out of care because they did not know where to go once they were released. And so this program was created to really help reduce that rate of recidivism, especially because they felt that the only way they can get care was actually in prison, because they weren't aware that they didn't have to pay for their medications. They weren't aware that they were eligible for free medical care because they didn't have the resources or the knowledge to know how to get access to that. Our responsibilities of the pre-release planner, I talked a little bit about that now. We go in and we assess the person, and we complete the needs assessment. At that point, we identify where they're going back for care and services. We tell them the different providers that are within that county or that city, and they choose which provider they're going to go to, and then we call and we schedule the appointments. We release the medical records to the medical provider as well as to the inmate, and we ensure that they do get the 30 days of medications. And if that has to be mailed because for some reason it was not there upon their release, then it is mailed. We do educate them on HIV and AIDS care and on the virus itself. We do communicate with the medical staff while they are incarcerated. We have different medical providers. It has changed a few times. A few years ago it was the state that provided the medical care. Since then it has changed to private entities. And so we have Wexford for part of Region 3 in South Florida. Then in Central Florida we have Corizon, which is Region 1 and 2, and also Region 3. So Region 1, 2, and part of 3 is by Horizon, which offers the medical care, and the southern part of Region 3 is Wexford, and that would be Arcadia, Florida, down to Monroe County. That's all Wexford. We do also work with the classification offices, especially when it comes to housing needs. And if they are homeless, we work in trying to get them placed in a shelter and see if we can get them to that first medical appointment as well. And if their charge doesn't allow them to go in the shelter, then we need to work closely with the probation officers, because if they do have that charge of sex offense, they cannot go in a shelter, and it's even more challenging for my sex offenders to get into medical care under Ryan White. So we work more closely with that type of charge with the probation officers so that we can ensure that even if they are homeless, that they will be able to go into care. If they're coming back to Broward County or to Miami-Dade, they will get referred to me, and that's no matter where they're serving their time. They could be serving their time anywhere in the state of Florida, and once the pre-release planner sees them and it is identified that they're returning back to one of these 2 counties, they are automatically referred to me. And then what I do is schedule an appointment for them to see me in the community so I can link them to care. And I'll talk a little bit more about that when we get to the community linkage part of this presentation. So we have the referral process for the pre-release discharge planners for those that are being referred to me or to anywhere else in the state of Florida for care. We complete the needs assessment. We identify what the needs are, whether it's substance abuse, whether it's housing, whether it's mental health. We deal with all of those pertinent issues because all of that has a big role to play with whether they're going to remain compliant with care. If they are in a facility where they're receiving medical care for their diagnosis and they're receiving mental health care for that diagnosis, we work closely with that as well and ensure that they're getting a mental health appointment when they are being released so that they can continue that care until everything is completed with their Ryan White process. They're all referred to the Ryan White medical care providers within the county that they're going to reside at, and appointments are scheduled with the inmate present, and basically this is the way that works. When we go the first time, we go through the list of providers in that particular area that they're going to reside at. They pick a provider. When we go back the second time, they already have that appointment date because we have already made contact with that provider, received an appointment so that we can give it to the inmate so that when they are being released in their medical records, they know where they're going for medical care and they know the day and the time. And the inmate is informed of the eligibility process for Ryan White. A lot of them don't know what it requires, and so we let them know that they have to have an ID and they have to have a Social Security card and they have to have proof of residency and everything else. And we kind of help them with how to gather that information. And we are very fortunate that we have providers within the state that will allow them to start the services with their prison ID because not all of them are released with a Florida ID card or a Florida driver's license. And so they do get to start that process with the prison ID, but within 30 days, it's important that they do have that complete and they do have that physical Florida ID to show to the Ryan White eligibility specialist. The inmate release package. Every pre-release planner completes an inmate release package, and it consists of our needs assessment that's done and what we identify their issues and challenges are with the resolutions as well of what's going to be done once they're released, their health information summary form, their HIV test results showing that they have a confirmatory Western blot, and if the Western blot is not in there, that they either have a detectable viral load. Their latest CD4 count, but again, we provide records for at least 1 year so that the medical provider can have a better idea of what was going on with their health issues while they were incarcerated. Any documentation of any opportunistic infections or AIDS-defining illnesses, lab reports, chest X-ray, any kind of notes that would be helpful. Their latest TST results, their vaccines, as well as their antiviral history, because we do have a lot of clients that will start on one cocktail during their incarceration and end up on a different one by the time of their release. So we do give a history of that. If there's a GenoSure test included in there, that would be included as well. The pre-release planners are the ones that create these packages, and they are the ones that leave it with the medical provider in the prison so that they can receive it upon their release. Once the appointments are made from the pre-release planners on our monthly reports, everything gets submitted to our office in Tallahassee, and our administrative assistant in Tallahassee, Ms. Miller, is the one that calls the providers and finds out the status on whether they were compliant with that first initial medical appointment. I'm going to talk a little bit about the Community Linkage Coordinator position now. This is the position that at this point is only in Miami-Dade and in Broward counties. And again, it was developed and created because we had a high percentage of positive peoples returning back to these counties, and there was a real need with getting them linked with medical care and support services sooner than later. So we have part of my job, like the other pre-release planners, in the prisons, where I would go in 90 days before they're released and get everything ready in preparation for their release. If they're coming back to these counties, they get an appointment to see me either in Broward or in Miami, wherever they're at, and I then meet with them personally, and I create a more in-depth assessment with them to really identify what are these immediate issues that need to be resolved so you can go forward and get yourself into medical care and other services that are required. So the CLC meets with the inmate and community, and it links them to medical care and social services. And the goals of the Community Linkage Coordinator is comprehensive discharge planning, collaborate with Ryan-White providers, establish linkages and support service, monitor clients up to 6 months to increase the medical compliancy upon discharge. The comprehensive discharge planning is when I meet with them. They may have some mental health issues going on. They may have not received their medications. They're not too sure where they want to go for services, or maybe the place they were going to is no longer in service or is not providing that service. So that's talked about and discussed, where they can pick another place to go to. We identify what other support services that they may need. It may be that they're homeless. It may be that they were released and they slept at the Greyhound station because they returned back at 3 o'clock in the morning. And so we need to deal with that and getting them in a shelter. I monitor them for 6 months in this program to really hold their hand during the whole Ryan-White process, getting them, once they have a case manager, to work with their case manager, giving them the opportunity to build that relationship and that rapport with the case manager. Also ensuring that they're able to get to their appointments, because just in Broward County, the first 5 appointments are the most crucial appointments out here. Once they come back, they have to get their Ryan-White eligibility appointment. Then they have to get their case manager's appointment. Then they have to get their doctor's appointment. Then they have to get their ADAPT appointment. So if they miss one of these appointments, they can really fall out of care, or they can run out of medications before they're able to complete the ADAPT process because they missed one appointment, it was pushed back another week, and they're only released for 30 days. That's it, no more, no less. So I really get to work with them more closely and make sure that they are not missing their appointments and that they're getting what they need in order to keep these appointments. They get linked to several different provider support services, and we have a few here: mental health, substance abuse, housing, Ryan-White case management. I noticed that with a lot of my clients, 90% of them are homeless. And that seems to be the biggest barrier. Some of them have family members that will help them when they're released but cannot house them because they themselves live in subsidized housing. And so we work very closely with the shelters both in Broward and Miami-Dade. And we have a working relationship where in Miami-Dade they will be picked up at the Greyhound station and be brought to one of the shelters that has a bed available. And in Broward, we specifically have a shelter that is kind enough to work very closely with my clients and accept them in. So as long as we are not dealing with sex offenders again, we have the collaboration with the shelters to get them housed so that they are not in the street. Again, the challenge comes if they're arriving in the county at 3, 4 o'clock in the morning because these shelters do not have transportation and we do not have buses that run. And what I do is I try and work with the offices at that point where we're getting them a ticket where they can arrive in Broward County maybe at 6 o'clock in the morning or at 8 o'clock in the morning in comparison to 3 in the morning, whereas at 6 o'clock in the morning the buses are running and we're able to get them where they need to go. As the CLC, I monitor the client's ability to adhere to drug treatment therapies. I assist inmates by identifying barriers to treatment adherence, provide HIV/AIDS education to assist with barriers, and provide transportation passes, clothes and hygiene vouchers. These are some incentives that we have. When this program, the CLC program, first started, I was asked to find out what their challenges are, have some reentry meetings in the community, find out what the challenges are for the providers, and come up with some solutions. And this is how the CLC program was created. And it was an awesome process because in talking with the providers, I really got to hear what their concerns and issues were and are to a degree for those being released. Because back then, it was much harder because they weren't being released with their medical packets or they didn't know who to contact in the prison to request this information. And they were being released with $100 if they met the criteria to get the $100, and that's it, and they had no clothes. All they had was what they had on their back, that one set of clothing, whether it fit them or didn't fit them. They didn't know where to go for food, so they would come back to these counties and they would be hungry. So it was really wonderful in trying to find out and hear what these concerns were and then partnering with these providers and putting things in place to streamline these services so that they didn't have to wait 10 days before they got that food stamp card to get food. And they didn't have to wait until they completed the Ryan White eligibility to see if they could get a referral to a thrift store to get some clothes. So it was awesome to be a part of actually creating this program and addressing these needs and getting the Ryan White administrators in these counties to come forth and bring the providers together and this service. So that was that's a wonderful thing about the CLC program, that I get to work more closely and personal with the providers, and the providers basically know who I am, and if there's a problem or concern, they call me and they just say, this is the person, this is the DC number, and I need this, and we're able to get them that information. We identified that there was a major housing issue going on because if they had felonies, they weren't able to get, low-income housing. There were some transitional programs that wasn't able to accept them if they had violent charges. Well, 90% of my clients have violent charges, and that was a very big issue. So it was a matter of really taking advantage of that. And
I'm so sorry. I think we lost our speaker, so I am just going to wrap up the presentation for her, but she was getting to the end. We just were finishing off on the fact that the patients are having difficulty with employment and seeking employment due to their criminal history, particularly because of their felonies, that it is challenging to find employment. So that is one of the things that they work on with the patients once they are released to the community. Transitioning to the community is also a difficult task. Many of the patients have been in prison and institutionalized for a long time. They have had a lot of structure. They are told when to get up, when to, they have to go down. They are given their medications at a very specific time as well as their meals. So getting out of the prison system and going into society where they have a little bit more flexibility can be a challenge for them, and the longer that they've been in prison, the harder this becomes. This also is a barrier when it comes to making sure they show up for their case management appointments, making sure they show up to their doctor's visits and access their medications. Prisons don't really have a lot of programs on working with patients to get back into the community and into society, so it becomes difficult for these patients to transition in an easy way. And due to funding constraints, there's a lot of issues with transportation, which she talked about earlier. There are provider networks for both communities. They include different partners from various social service agencies, including medical, food, housing, substance abuse, mental health, halfway houses. And there are network committee meetings that they have in both Broward and Miami-Dade that are listed here, particularly surrounding housing, since that is a big issue, and reentry into the community. And lastly, just this is a list of the provider network in Miami-Dade, and you can see all of the different various providers that have relationships with pre-release planning and community linkage programs, as well as the provider network in Broward County. And keep in mind that this particular program is for Miami and Broward only, although it would certainly be good for the other communities in the state. This sort of wraps up the slide presentation, and at this time we can take questions from people. So one of the questions is, what about county jails? I'm not sure specifically what the question is about county jails. I can tell you that county jails are very different than prison systems. They are not operated in the same way, and the presentation that was done today was specific to the prison system. There are the map that you saw earlier about pre-release planners does not apply to local jails. It only applies to the prison system. The same thing when it comes to the 30 days medication from the prison system. Jails are different based on the individual jails in the community. There is no requirement of 30-day medication supply because people are in jail for a couple of hours, a couple of days, 2 weeks and months, or up to a year. So unfortunately, jails are a very, very different scenario and do not meet the qualifications or do not have access to the same level of services as those that we talked about today that were coming out of the prison system. So there are some areas in the state where there are, particularly in the higher incidence areas, the Palm Beach, Broward, Miami, Jacksonville, where there are pre-release planners through the Part A and Part B funding, and they have pre-release planners within those jails in order to help with transition in and out of the jails, but nothing to the effect of what we were talking about today on this presentation. I know a lot of people ask the question is, what if a client shows up without the package that was talked about earlier today that has all of the information in it? We would encourage you to download these slides because there is a map with all of the people who are the pre-release planners, and I would encourage case managers or ADAP workers to call the pre-release planner if the client shows up without a package and you need the information, and see if you can go about getting another package, because reaching out to the discharge planners is how you can go about getting access to that information. I apologize for the mishap at the end. As with all things technology-based, sometimes that stuff happens, but luckily she was able to do the majority of the presentation.
The Florida Caribbean AIDS Education and Training Center's mission is to ensure that physicians, nurses, nurse practitioners, physician assistants, dentists, pharmacists, case managers, and other healthcare professionals in Florida, Puerto Rico, and the U.S. Virgin Islands receive state-of-the-art information, training, and consultation on the prevention, chronic disease management, and treatment of HIV and AIDS. Funding is provided by the HIV/AIDS Bureau of the Health Resources Services Administration, U.S. Department of Health and Human Services. The Florida Caribbean AIDS Education and Training Center provides a variety of HIV/AIDS education, training, consultation, and resources, Visit our website, www.fcaetc.org, to learn more. Stay in touch with us by joining our mailing and email list. You will receive notices about upcoming educational opportunities as well as new and updated HIV/AIDS resources. You may also sign up to receive our HIV CareLink newsletter. Visit our website, FCAETC.org, and click on Join Our Mailing and Email List at the top of the homepage. Be sure to also connect with us on Facebook, Twitter, LinkedIn, and YouTube. The Florida Caribbean AETC provides consultation services to clinicians in Florida, Puerto Rico, and the U.S. Virgin Islands. If you have questions related to the content of this program or would like consultation on the diagnosis, prevention, and treatment of HIV/AIDS and related conditions, we would love to hear from you. We also offer consultation on the interpretation of resistance test results. Visit www.fcaetc.org/consultation to ask your question today. The Florida Caribbean AIDS Education and Training Center provides pocket-sized treatment guideline resources that detail the federally approved HIV/AIDS medical practice guidelines, such as the adult antiretroviral therapy, hepatitis, pediatric antiretroviral therapy, adult opportunistic infections, tuberculosis, and pre-exposure prophylaxis, non-occupational post-exposure prophylaxis, and occupational PEP. In addition, we have summarized common practices for the post-exposure prophylaxis in pediatrics adolescents. We have also developed resources that provide an overview for treatment of sexually transmitted diseases in HIV-infected patients and therapeutic agents for oral manifestations. Visit our website to download or request copies of these resources. The Florida Caribbean AIDS Education and Training Center provides web-based educational opportunities to increase the knowledge and skills of HIV healthcare providers. Live and on-demand options are available. Visit www.fcaetc.org/education for more information. Florida Caribbean AIDS Education and Training Center, Project ECHO, provides a web-based didactic presentation on a current HIV treatment issue based upon current Department of Health and Human Services and other accepted treatment guidelines. Project ECHO also provides an opportunity to discuss case presentations submitted by participants and an opportunity to network with both your peers and HIV experts. All members of care and treatment teams, including case managers, are welcome to participate. Information discussed is targeted at providers with basic or intermediate HIV/AIDS treatment experience. Choose from 4 session types. Visit www.fcaetc.org/echo to view upcoming sessions and to register. If you're located outside of our region, the Clinician Consultation Center provides consultation services via the phone numbers listed here. Or you may also visit www.nccc.ucsf.edu for more information. To locate the AETC in your region, visit www.aidsetc.org.